This is the Urban Debate on Magic Bricks Now. I'm Faye D'Souza. Absolute chaos in the city of Delhi as we have several cases of chikungunya and dengue being reported every day. In the meantime, nurses are on strike, hospitals are stacked to the brim and medicines are not available. In all of this, where is the Chief Minister of Delhi and why isn't he taking this health crisis more seriously? On your screen right now is footage that we're looking at of hospitals in Delhi. Remember, a lot of the hospitals in Delhi have actually reported that 30% of the doctors and the staff have been diagnosed with dengue and chikungunya, and they're not at work either. We don't have enough nurses, we don't have enough doctors, we don't have enough medicines. And somehow, nobody in Delhi, most of which is embroiled right now in a sex scandal, is taking the health of its citizens seriously. It's the national capital. Obviously, everybody wants control over Delhi. The Aam Aadmi Party government, the BJP appointed Lieutenant Governor and the civic bodies run by the BJP. Everyone is fighting it out and caught in the crossfire of the city and its citizens. Here is a special report of the chaos and the abject mess that Delhi is in today.
You guys all deserve an award for being able to get here today. I don't know if you came in boats or amphibious vehicles of some kind, but I salute you for being here. Thank you very, very much for making the effort.
Stinging sarcasm from the US Secretary of State, who was on a state visit to the national capital this week. His statement, posted and reposted on social media, was enough to make any proud Indian cringe with embarrassment. But not the powers that be in Delhi. A day after the deluge, here's what CM Arvind Kejriwal was busy doing.
Delhi government led by the Aam Aadmi Party has moved Supreme Court primarily against the High Court order. The order had said that the protocol remains, which is that Lieutenant Governor continues to remain the administrative head.
The Lieutenant Governor and the civic bodies, meanwhile, maintained a stony silence. As political parties got busy politicking over the latest AAP-engineered controversy, citizens continued to suffer.
मुझे तो नहीं लगता केजरीवाल साहब ने काफ़ी अच्छा काम किया हुआ है. अगर ऐसा होता तो उनके जो मिनिस्टर्स हैं वही करप्ट ना होते.
तो ऐसा जो ये केजरीवाल जी कहते हैं मैं ये कर दूंगा वो गए, यहाँ से ये पब्लिक की एक लहर थी उस टाइम जो ये जीत गए, और आज की डेट में भी इलेक्शन हो जाए तो आम आदमी पार्टी नहीं आएगी.
Choked and pothole roads are just one aspect of the civic crisis that the capital is grappling with. With the skies opening up, city hospitals are flooded with dengue and chikungunya cases. According to an MCD data, Delhi has recorded 432 cases of chikungunya and 487 cases of dengue and 20,311 cases of the vector-borne disease. These are the numbers as of 27th of August. And these are merely those cases that have been reported. As Magic Bricks Now found, hospitals are rapidly running out of beds and essential medicines.
परसों से भाग रहे हैं इस हॉस्पिटल में, रात से कोई नहीं सुन रहा है. और कल थोड़ा बहुत एक दो बोतल चढ़ा दी थी ग्लूकोज के, बोले अब घर जाओ.
मैं नोएडा से लेके आ रही हूँ. इसे फीवर है, कोल्ड है. इसको डॉक्टर ने तो देख लिया, इसको ब्लड टेस्ट के लिए बोला है, बट अभी तक नंबर नहीं आया. हम 8 बजे से यहाँ खड़े हैं और हम नोएडा से आए. हमने बहुत हॉस्पिटल का नाम सुना था, हमें कोई भी सुविधा दिख ही नहीं रहा है. और ये भी बच्चा भूखा है, मैं इतनी सारी बिस्किट लेके खड़ी से दे नहीं रही हूँ. ये भूख के मारे तड़प रहा है, अभी तक नंबर नहीं आया.
And if this was not enough, the city's nurses went on strike on protest against poor working conditions. The situation has got so bad that the government has invoked the ESMA, or the Essential Services Maintenance Act, against striking nurses. In the meantime, Delhi's report card gets worse. Last week, the National Crime Records Bureau released data that proved that the national capital was also the crime capital of the country. Delhi tops the list of Indian cities in the number of crimes reported against women. A total of 1,893 rape cases and 4,563 assault cases were reported in the last 1 year alone.
Well, obviously, the capital is in a crisis of health, which should be on top of the mind. But where is Chief Minister Arvind Kejriwal? Joining me on the show tonight, Raman Malik, BJP spokesperson, Chaitanya Singh, spokesperson of the Congress, Shobha Vijender of the Municipal Corporation of Delhi, Dr. Santosh Mehrotra, Professor Economics at JNU, Professor Dr. Sanjeev Bagai, Vice Chairman and Director of the Dwarka Municipal Hospital. Advait Kala, who will join us in a bit. The question that we are asking this evening, and I'll start with Raman Malik. Raman Malik, absolute chaos in Delhi, given the number of vector-borne, mosquito-borne diseases that we're seeing spread in Delhi right now. Where is the Chief Minister? Why isn't this being taken more seriously? Why isn't there a crisis sort of a plan being made? In fact, to make matters worse, we saw Delhi flood, which will only add to the problems of mosquito-borne diseases, and no response at all from anybody in the government.
Okay, Fahid, let me answer it in a different way. I'll answer your question on the second, but let me put some facts to you. Kalawal Nagar, a constituency of Delhi, the MLA is Kapil Mishra, and we believe that he is taking care of the Delhi Jal Board, which also has some part of sanitation in it. The biggest problem in his constituency is the choked drains. Then, if we talk about another one, and I'm just giving you 2-3 examples. Matia Meher, again, the MLA Asim Ahmed Khan is there. He said last year he did some 7 crore rupees of money was spent for the same drains and other things in MLA LAD funds. Then he says this year 200 crores on 13 stretches are being spent. Don't know where that is.
Raman Malik,
Further
Raman
on,
Malik, okay, let's
now comes a classic case.
Can't the central government step in this case? Can't the central government step in this case?
Please understand what I'm trying to say.
You're saying that the MLAs are not doing their job. You're saying MLAs are not doing their job.
And this is important.
Okay. Okay, go ahead. Go ahead.
The Deputy Chief Minister Manish Sisodia, his area of Shashi Garden Jhugis, they have such a problem that they have raised their height of the flooring by 3 feet, and the entire height available in the house is some 7 feet only. And the hospitals that are doing the major service are AIIMS and other, which are taken care by the central government. Now, where is the Chief Minister when we talk about a Chief Minister without portfolio?
Okay.
Who is busy protecting...
Let me interrupt you for a second. You said AIIMS is being run by the central government. AIIMS is being run by the central government. So Raman Malik, AIIMS has received a notice from the MCD for being a mosquito breeding ground. AIIMS has received a notice from the MCD for being a mosquito breeding ground.
MCD is picking up almost on your channel, Fahid, on your channel the other day, the person from representing MCD very categorically told you that they are picking about 10,000 metric tons of garbage every day.
What does that have to do with the mosquitoes? Raman Malik, you said AIIMS is being run by the central government. You said AIIMS is being run by the central government. AIIMS has received a notice from the New Delhi Municipal Council for being a breeding ground for mosquitoes.
391 are in AIIMS.
AIIMS is run by the central government.
See, the point is wherever we have any interference, you're talking about AIIMS being a breeding ground. It's a big facility which is overworked.
That's no excuse for it being a breeding ground for mosquitoes. Professor Sanjeev Bagai, the fact that AIIMS, considered one of the best hospitals in the country. I'm not excusing anybody. I think that every...
Please tell me how many cases have come out of AIIMS.
I will tell you. I will tell you how many doctors, All India Institute of Medical Science, 50 medical staff and 12 senior faculty members have dengue. 50 members of the medical staff and 12 senior faculty members of AIIMS have dengue.
That cannot be only said that it happens only because of they are in AIIMS.
Dr. Sanjeev Bagai, help me out here. If there are mosquitoes breeding on the campus of AIIMS, will that not cause the senior medical officers to get sick?
Most of the area management, barring the AIIMS facility is with Delhi government.
Please do, sir. Go ahead. Dr. Bagai, please do.
Yeah. I think to give it more shape as far as this discussion is concerned, we face this crisis almost every year. This year it has been, I would say, beyond epidemic proportions, beyond a crisis situation. One, because the rains are incessant now. And having said that, the worst as far as dengue, chikungunya, malaria, vector-borne diseases is yet to come, which classically comes around September till end of September, early October. The mosquitoes are still obviously breeding. The sanitation of Delhi, the water treatment plants of Delhi, the waterlogging of the roads is only compounding to this fact. The overall scenario as far as dengue, chikungunya, vector-borne and other viral diseases is immense. Just today I have seen about 6 new patients which have been diagnosed with chikungunya or dengue. And this is just one doctor amongst 50,000 doctors in Delhi. I think what has really happened is it's a failure of governance. Maintenance as far as roads is concerned, insensible digging up of the roads, waterlogging is concerned, maintenance of the drainage of system of Delhi is concerned, is never a glorified thing. But nothing is done through the year to maintain this. And this is what we are in. Actually, we are in a capital mess.
You're in a capital mess and it's an epidemic. Dr. Bagai, tell me this. In the cases of epidemics like the one we're seeing right now, what sort of reaction would you expect from the state government? You called it an epidemic and that's a serious word. What reaction should we expect from the state government?
I think the full planning should be around in early part of the year. Making a contingency plan for this part of the time of the year. We know that monsoons hit. We know that last year dengue had hit and before that it had hit. This year we've seen a great uprise of chikungunya. And it's not a one-off disease. These diseases cause long-term complications and sequelae in patients. And it's not fair. I think any illness which is preventable, to allow that to happen is not fair. What I would expect from the Delhi government is governance, stop fighting with the centre, get your act together. These mohalla clinics and other things which you're doing, you can continue to do, but medicine should be available. Proper, adequate manpower should be available. The nursings, the technicians, the doctors should be available. Satellite clinics need to be set up to screen for fevers so that every small fever doesn't overflood the hospitals. I think there should be a systematic rollout of plan. There needs a synergy between the government hospitals and the private hospitals, and Mr. Kejriwal needs to work.
Mr. Kejriwal needs to work. Dr. Santosh Mehrotra, appalling state of affairs in our capital city. And we've seen this happen day after day after day. And I think that it's embarrassing, and we should be embarrassed as a country that we're being distracted by a cheap sex scandal instead of a massive health crisis, as we had the doctor just mentioned.
I'm so delighted that you are focusing on this issue as opposed to the sex scandal. So I think you deserve to be congratulated, first of all. I want to remind all your viewers that, about 10 years ago, the previous central government had initiated a national rural health mission. But there has almost never been an urban health mission, and urban health has been neglected systematically by both the previous and unfortunately the current government as well. We've now recently had the emergence of a national urban health mission, which has now been combined. This shows how little emphasis is given to urban health in strategic planning. This is a huge planning failure in terms of strategic planning in the health sector. When on top of this, situation, with both state and central governments not spending more than 1.2% of national GDP on health, if you have rain levels of the order that Delhi has just experienced, then what happens is that municipal solid waste begins to accumulate and rot on top of that on account of waterlogging. On top of that, if rain water doesn't leave the roads, then you have puddles emerging everywhere, rainwater collecting everywhere, and mosquitoes breeding. And I'm so glad that Dr. Bagai emphasized the point that we're only at the beginning of the crisis. The chikungunya dengue crisis will come about a month from now. So if whichever government is responsible for this, I think central and state government of Delhi really need to get their act together to prevent this crisis, or the deepening of the crisis that Dr. Bagai is actually hinting at is coming in about a month's time.
And the footage that we're looking at, Raman Malik, the footage that we're looking at right now, 4 patients to a bed in Delhi. The hospitals aren't prepared, governments aren't prepared. There isn't enough medicines.
2-3 quick points.
There aren't enough medicines. There aren't enough nurses. What's the solution, Raman Malik? Don't you believe the centre and the state should take equal responsibility?
Which I would like to make. 2-3 quick points. We are not going out of the preview that we should not take the responsibility as the responsible party in the centre. Our health minister has come forward and given all possible help to any form, and increasing the number of beds or medicine availability or whatever is required has been given in abundance.
No, Raman Malik, while I respect the fact that unlike the Aam Aadmi Party, I'm showing visuals on my screen right now, which maybe you can't see. RML Hospital reports to the central government. I'm looking at visuals of 5 patients to a bed.
I do not have the screen in front of me. I cannot see the visuals.
No, I'll tell you what we're looking at. RML Hospital, 5 patients to a bed. RML Hospital reports to the central government. It's run by the central government.
But let me give you. Can I please complete? Can I please complete?
No, I'm just letting you know what we're looking at on the screen. You're giving us
as per as the garbage is concerned.
Statements. Yeah.
As per garbage is concerned, please listen to me. Let me make my point.
Okay, go ahead.
As per the garbage dumps are there. The innovative point that we have done, our road and surface transport minister is utilizing that huge dump into the making of NH24. So that is a constructive thinking, and that would reduce the problem which earlier governments never saw about, nor this government in Delhi. All the more, one more thing which I would tell you is that the government of the day Delhi required to be proactive, which it wasn't, and misplanning by the earlier regimes is also a very big part in this mess. So they even cannot shirk their hands off. 10 years they could not create a robust system to carry the problem. Every second year
I'd like to remind you that the government of the day, there are 3 governments of the day in Delhi. There are 3 governments of the day in Delhi. There is the state government run by the Aam Aadmi Party that should take maximum responsibility. I agree with you. There's also a central government that runs the hospitals in Delhi.
I am not refuting to that. Why are you talking about Aam Aadmi Party, Vahid? Their chief minister, why are you talking about Aam Aadmi Party? Their chief minister is least bothered to even have a portfolio.
Shobha Vijendra, the MCD has given 1,300 notices to various establishments in the city of Delhi for being breeding grounds for mosquitoes. And I want to read this out to our audience so they understand it. According to reports, AIIMS, Safdarjung Hospital, Lady Hardinge Hospital, RML Hospital, every big hospital, Baroda House, Kashmir House, Red Cross Society, Shivaji Stadium, Delhi High Court. This is the state of Delhi as a city, and we are not even going into the bastis and the gullies and the smaller areas that are never cleaned. These are areas that we assume will be cleaned. These are areas that come under the central government. I think there's an equal, tripartite responsibility that needs to be taken by everybody who runs Delhi, and we should stop passing the buck.
No, I want to start with a very positive note. First of all, I am representing MCD. And I want to tell you that MCD is well ready for everything because we have planned everything in advance. I would like to tell you that there are 3 types of, fevers. Chikungunya is prevailing, and malaria and dengue is there. But I would like to tell you, I am a lay person, doctors are sitting here, but I want to tell you the actual figure. The actual thing is that viral fevers are very prevalent, but people are running post to pillar in government hospitals, in private hospitals, because they are panicky that chikungunya is there or dengue is there. That I want to make you clear. Yeah.
So you're saying that people are misdiagnosing their viral fevers for chikungunya and panicking.
Dengue cases are coming in the coming weeks or coming days. And I would like to tell you that we have done taken so many preventive measures, starting from that we have doubled our domestic breeding checkers. This is the number where domestic checkers go door to door. They search every place where there is clean water they are gathered, because all the dengue mosquitoes breed only in the clean water. We are going where the case happens. 50 houses are searched. They are given the fogging. They go and do the focal spray. So MCD is definitely doing its role, and we are ready to do it, because we have this thing in mind that we have to work for the people of Delhi. And I would like to say, because Delhi is the capital, everybody has to work. The central government has to work, MCD has to work, and definitely 3 municipalities are working day and night. We have established our helpline in every zone, in 11 zones. And there our doctors sit there from 8 to 8. We are working 12 hours there. Every councillor is going every road, every house, because we are really panicky, we are really worried for the people of Delhi. But again, I want to know where the problem starts, where this missing link, where this state government plays its role, where is this Lapata CM? I too want to know, because I want to tell you one thing, that there is a big Najafgarh Nala, and that is not being cleaned by the PW, and you believe this Najafgarh Nala is one of the biggest drain, and that is not being cleaned. All the small nalas go to the bigger nalas of PWD roads. If PWD roads nalas are not being cleaned by the PWD department of Delhi government, then what MCD can do? It's a very important question. I definitely congratulate you for raising this issue, because I want to know where is state government playing its role.
It's a very good question. Unfortunately, the Aam Aadmi Party, Shobha Vijayendra, the Aam Aadmi Party refuses.
What role he is playing?
The Aam Aadmi Party.
What the PWD minister is doing?
All right. The Aam Aadmi Party refuses to be part of any of our discussions repeatedly after inviting them over and over again. They just refuse to talk about these issues. But I want Professor Dr. Sanjeev Bagai to tell us, do you believe, like Shobha Vijayendra is telling us, that the MCDs have been prepared, proactive, ready? Do you believe that the central government-run hospitals have been prepared, proactive and ready for what has happened so far in terms of the health crisis and what's going to happen for the months to come?
See, to put facts on the table, as it is, Delhi has a shortage of beds. Delhi has a shortage of doctors. I'm not going into the statistics. It's there on the net. Everyone can read it. But already with restricted resources, we are being stretched to our limits. Our healthcare system is ready to face, but we can only see and only admit as many number of patients as the infrastructure allows. Point number 2 is the proof of the pudding is in the eating. The roads are senselessly dug up and never filled in. The pavements are dug up, they are never filled in. I'm not blaming a blame game between PWD and MCD and other government agencies, but we need a more synchronized, more systematic approach. I'll give you a classical example. It's like a couple of surgeons opening the abdomen. One fixes the liver and the other person forgets to fix the kidney, and the third one comes to fix the bladder. That's not the way we approach it. That some days the electrical guys are digging up the roads, another day the water guys are digging up the roads, and then the cable guys are digging up the roads. The metros are going late, the schedule is going late, there is a traffic mismanagement. Overall, our systems need to work in a coordinated manner. The healthcare delivery system is the end point where the patient goes to. But let me reiterate again, the worst is still to come. And I still feel that we can have a little bit of a catch-up time if we get our systems back in order.
If we get everybody to
we
work
will see
together.
a surge of patients in September till end of September, early October.
Bimlendu Jha, you're an environmentalist and you run an organization that works with cleanliness in Delhi. You must be having a harrowing couple of months. Tell us what the situation is like on the ground.
Yeah, exactly. So I think, right now hearing the BJP spokesperson and also the NCD representative, it's almost a borderline posturing, justification, denial that we are actually hearing from our political class. And I'm telling you, if PWD was run by BJP and if MCD was run by Aam Aadmi Party, things would not be any different. There is systemic problem in the way our political class looks at this responsibility, because it's not just a Delhi problem, by the way. The same situation that we are talking about Delhi is in Gurgaon as well. We've seen Chennai, we've seen Bangalore. And today, of course, we're talking about Delhi. We need to understand that it's not a matter of inconvenience only.
Sorry.
It's not.
These are wrong facts.
These are not wrong
I can
facts.
give you data. I have just tweeted. The data is there. There's a drop of over 50% this time.
A drop of over 50% of what, Mr.
If there is some
Malik?
kind of political responsibility that you have, then there needs to be
last year. We are doing the work. We are moving in the right direction.
That is what I'm saying. We are doing our work, but if there is a missing link, we
What is
all
the
have
missing
to.
link?
We
What is
all
the
have
missing link?
to
I
talk on
have
that,
tagged
and we
you.
have to
Please
work
see
on
the
that.
data. These are authentic data. I am giving you the data till August, comparative of August 16 and August 15. Please see it.
When will it be that you will?
And I've openly tweeted it. If anybody is open to challenge them.
And I would like to say, if we have issued so many notices, it again shows that MCD is definitely working. And where is the missing link? We don't want to.
From both the Delhi government and the MCD, sadly there is no representative of the Delhi government sitting on the show here. Madam, you are representing the municipal corporations. I would like to ask you, how many fogging drives has the MCD carried out till now? And how many drives for educating the people of Delhi as to how they can, save themselves from vector-borne diseases have been carried out by the MCD? You are continuously being seen as passing the buck either to the Delhi government or to anyone else. Why is it so that you people keep squabbling amongst each other, and you just to hide your failures? Why is there such a scenario emerging in the city? It is very much so like that. We do have a missing chief minister, but what is the MCD doing? You're saying you're sending notices. What is the point of sending notices? It is the job of the MCD to go.
If the private institution or the government institution are not taking care of the water logging, then we have to issue the notices. What else we can do?
Fair enough.
What else we can do?
Shobha Vijayendra, who is supposed to keep these places clean?
No, I want to answer his question. I want to answer his question. He's saying that we are not doing anything. I would like to tell him that we are doing very intensive awareness programs. Even we are going to a very small gathering of 20 people, 30 people. We are going and telling them that please keep your places outside or inside the houses. Water should not be gathered at one place. Clean water can also breed the mosquitoes. We are doing our job. Then as far as Delhi Sarkar role is concerned, it is our duty that we have to tell the people of Delhi that missing link. We are not passing the bucks. We are telling the people the reality. The reality. No. We are saying We are saying people the reality. People should understand that why such a situation is emerging.
Shobha Vijayendra, quick question to you. Shobha Vijayendra, quick question to you. If you're saying
the government is doing the same.
Shobha Vijayendra, if you say that the MCD can only issue notices. Shobha Vijayendra, 1 second. You said
if we can't do anything with the big nalas because it is the duty of the PWD.
Okay. Shobha Vijayendra, AIIMS, Safdarjung Hospital, RML Hospital, whose responsibility is that space?
Then we have to tell the people of Delhi. We have to tell the people of Delhi that Anas is no more because PWD's nalas were not covered. We have to ask the CM, where is he? Where is his cabinet? Where is all they have gone to the jails?
Dr. Bagai.
Sorry, state of affairs have encompassed the national capital.
CM, his friend and his home minister have gone to Vatican.
Dr. Bagai, go ahead.
Yeah, I think if you really understand, it's not one agency versus another.
Go ahead. Go ahead, doctor.
It's not government versus
one
the
agency
state.
is not doing
I think
its
if
role.
you keep this discussion,
but sir, if one agency,
in times of such crisis,
Dr. Saab, if one agency is not doing
whether it's the corporation or the government, they should work with each other.
Their big nalas are not covered.
all the small nalas have to go to the big nalas.
One second.
All the
Chaitanya Singh and Shobha Vijayendra, 1 second. I want to hear the doctor's opinion.
Because nalas are not being cleaned by the PWD.
Okay, Shobha Vijayendra, you've made your point. I want to hear both now, Dr. Bagai and Dr. Mehrotra. Dr. Bagai, you first. Obviously, every time we have a conversation, we've had repeated conversations about Delhi over flooding, about garbage, about waterlogging, about air pollution. It always winds up in a scrap between the three agencies. Why can't we just come together, set aside our differences and actually work? Dr. Bagai, what do you need as a doctor who's fighting this problem on the ground?
Yeah, I think we have to look beyond the word nalas. I think we have lived with them for many decades now, which have been unmanned, uncleaned. I think prevention is never a fashionable word in India. Unless and until we don't work through the year, we will land up with the same problem again next year. I think desilting of the drainage systems, keeping ourselves future ready, even now if we work and do the road repairs in a proper manner, see the quality of work with which the roads are repaired. Look at the construction sites, the way they've been managed. I think there's an immense amount which needs to be done. This is not a point and a stage in which we throw mud at each other and say whose fault it is. I think it's a collective responsibility. I think we cannot have citizens of Delhi or any other city in any state in India dying of vector-borne diseases. We are going back. This is so neuroregressive.
Yes.
Internationally, we are becoming a laughing stock. On one hand, we are saying we are a destination of international medical tourism. We are going to put people away from us. People are not going to come to us.
There's no law and order. It's completely breaking down. Crime against women shooting through the roof. There isn't enough facilities in our hospitals. There are no medication and Delhi is crumbling. Dr. Mehrotra, go ahead.
Well, what I want to emphasize is to take the point that Dr. Bagai is making over and over again, which is that in a time of crisis, the three governments of Delhi should be coming together. But all we are hearing, even on your television program, Faye, is mudslinging at each other. I am absolutely appalled, and the Delhi citizen should be appalled. My second point is that, Dr. Bagai rightly emphasized that there should be planning for this well in advance. What is the meaning of planning for this in advance? It means that we have to begin to take our problem of municipal solid waste much more seriously than we've ever done in urban planning so far. If we don't do something about from our homes, starting from our homes, each one of us, this responsibility belongs to each one of us who's listening as well as who's participating in this program. The dry waste has to be separated from the wet waste. The wet waste is what we generate in our kitchens. 50% of the waste that is generated in any city in our country is wet waste, which can easily be separated, and because it is biodegradable, it can be composted. Only 18% is dry waste in the sense of paper, plastic, and glass and so on. The rest is in the form of debris.
Segregate,
If we started to separate this, that's right, separate and segregate this from our home onwards, then collection should be accordingly by the municipal bodies in separate solid waste bins. When you walk around Delhi city, do you ever see any kind of waste bin? You don't even see a waste bin. What are the citizens of Delhi supposed to do? So they litter everywhere. When they litter everywhere, this litter accumulates on the side of the road and then it clogs the drains. When the rains come, then the rainwater doesn't clear.
Right. That's what we're looking at on our screen right now.
How is this situation going to be resolved?
Vimlendu Jha, I just want one word from Vimlendu Jha, and then I'll come to the political parties. Vimlendu Jha, is it just about segregating, or is there a need here for everyone to simply work together?
Exactly. So you know what, in my day job, I actually talked about what citizens can do, but the crisis that we are in today, we need the systemic solution to this. There has to be better planning, better coordination, better execution, better governance, and therefore better government. And I think all of this is been missing completely in our country right now, and more so in Delhi NCR. We also I need to point out that, MCD, when it says 90% of MCD's waste budget goes into transportation of waste, it does not mean waste management. So when they say, oh, well, we are actually doing a very good job of lifting 10,000 metric tons, they're only taking it from point A and dumping it at point B, rather than actually managing it environmentally and responsibly. So we need to understand that all these issues are connected. Our political class has to have that political will. Our administration, our executive needs to have that will to really understand, accept there's a crisis, accept that we have all inherited that because of our lifestyle or because of our politics, but we need to really fix it. We don't have the luxury of time. We need to understand it's a public emergency. And it's not only about the mocking done by John Kerry. It's about lives lost. It's about revenue lost. It's about economy, ecology, and health loss. And our politicians on your program also need to really stop joking and passing the buck all around. And so, well, we did it right, the other one did not. I think all of us will have to come together and not let citizens be at their own pity. So
right.
I think
Okay, let me take that to the political parties on the panel right now. Raman Malik, you've had your hand raised for a while. I'm going to come to you. I agree with you on the point that the Chief Minister of Delhi has let the city down. That the Chief Minister of Delhi has not been accountable and the city has crumbled. But that does not absolve the central government. That does not absolve the MCDs.
Let me basically put forward a basic, or let's say the main points here. One, Delhi government could have utilized the 28.5 crore rupees which is spent on ads nationwide to make Delhi aware of what the crisis they were facing, or they could have faced, and they are facing today because of lack of awareness. Because masses have to be made aware. Second, the Prime Minister anywhere and everywhere is going, committing, telling people, please be clean, keep your cities clean.
You should be holding up.
And everybody is doing that. Everybody is making people aware of that. And third,
don't give me rhetoric. Don't give me facts. Don't give me facts.
I was not disturbing the debate. My request is, please don't disturb the debate. Otherwise, I can very well disturb this debate.
Time and waste governance.
If you're referring, Raman Malik, if you're referring to the Swachh Bharat campaign,
the third major point which needs to be made aware. See, I will come to that also. But what I'm trying to tell, the third important point which should not be missed for Delhi is, Nitin Gadkari ji is taking over the entire waste from Ghazipur and utilizing that into the NH24 that is being built. This kind of innovative thinking could have been done previously also, but people were not ready to do it. So at least accept this much, that there is somebody who's ready to do innovative thinking.
I would like to make a small point.
A responsibility of the municipal corporation, yes or no, sir?
They say no.
Yes, it is our responsibility.
So, one problem leads to another. Water logging is obviously a
Can you repeat the question?
The cleanliness is not being maintained properly. That is why there is water logging. Obviously, the Aam Aadmi Party government is also to blame for this.
Sir.
But is the MCD not to be blamed?
Sir, I will give you the answer right away.
Genuine problem, please.
Sir, please tell me if the colony sewer is jammed and your house sewer is clean, what is going to happen?
No, see, this is...
You tell me if the colony sewer is jammed and your house pipes are okay.
Our problem is very genuine. No, listen to us. Listen to me, please. If we are maintaining the small nalis, we have cleaned it up only in the month of April, May, June. But all these small nalas go to the big nalas, and these big nalas are not being cleaned.
Vimlendu Jha, are all the small nalas in Delhi clean? Vimlendu Jha, are all the small nalas in Delhi clean?
No, I want to say something.
Not at all, and that's why I'm saying.
No, please, I want to say. I want to raise one very important.
Any normal citizen of the city and ask them this question. Whether all the nalas according to her are cleaned or not.
Yeah, that is the major problem. That is one of the major problems. Water logging problem came because of this.
If we yell at each other, we will not achieve anything.
Water logging. Listen to me. Water logging problem emerged because of this only, because big nalas were not cleaned properly.
All right. Shobha Vijayendra, I've got your point.
Water logging problem.
Do not yell at each other. I have your point. Just 1 second. 1 second. Let me just back up. Shobha Vijayendra, 1 second.
For your information,
as a citizen
we had a problem in Gurgaon because of Najafgarh Nala not being cleaned in Delhi.
Okay.
That could be one of the problems.
Okay, 1 second. Shobha Vijayendra, 1 second. Let me bring in other people into the debate as well. Shobha Vijayendra, 1 second. 1 second.
Water has to go
1 second. Just give me 1 second. Just give the other people a moment to talk. Both of you. Just 1 second. Thank you. Vimlendu Jha, you're doing research in Delhi. Is it true that all the small nalas run and cleared by the MCD are actually clean and only the large nalas are still blocked?
Let me make a very small point. Let me make a very small point. Let me make a very small point.
You're not letting him speak. Shobha Vijayendra, you're not letting him speak.
Because he raised a very relevant question.
Isn't it, it's something of a joke when MCD says that it's one of the most responsible and accountable institutions that we have in the country? Don't we know there is enough evidence for us as ask a citizen on the street, and we don't need experts for this, the kind of governance that is
don't do like this. If I'm telling you if I'm telling you as an MCD, if I'm telling you as an MCD person that we have done this much, we have taken so many preventive measures, we are going to every person.
Okay, let me get a voice.
Our small constituencies. We are going
You're not letting him finish. Shobha Vijayendra, you're not letting him speak.
We are going to our small constituencies every day on daily basis.
You're sending notices, you're saying you're carrying out awareness campaigns. What about fogging drives?
We have to prosecute.
Still there are the number of cases and the number of people
give me one. Okay, please allow me to say.
I don't know where you live, because you haven't seen
I would like to say, I would like to say that.
Because Delhi, the one that
I would like to say that for making Delhi clean. No. You have forgotten one very important thing, that really to make Delhi clean, we need the public support also. I would like to tell
we need
the people of Delhi that in Rohini itself, we have installed waste bins in ward number 9. No, I would like to tell you the actual situation. Then what happened after 7 days? All the waste bins were stolen. All the waste bins.
Keep giving yourself a medal that you're doing a good job, madam. Ask a citizen on the
If I'm telling you something very positive, if you are not listening,
all the work that you claim to have done, it's not showing any results on the ground.
No, somebody said.
Okay, hang on. Hang on.
It's going from back to work.
We can keep talking. Hang on, Shobha Vijayendra, hang on. I just want a moment's silence. Just 1 second. Shobha Vijayendra, 1 second, please.
But after a week, all the waste bins were stolen. I'm just saying.
Just 1 second.
I just want to tell you that after 70 years of independence, this is for the first time that National Urban Health Mission has come into picture. Now
okay, done. All right, we got your point. You made your point. Shobha Vijayendra, 1 second. Enough.
Thank you.
Dr. Sanjeev Bagai, as someone who is not affiliated or not associated with any of these agencies and any of these political parties, as a citizen respected of Delhi, Shobha Vijayendra, please let other people talk. Dr. Bagai, as a respected citizen of Delhi, please tell me, are the streets clean? Do you feel that the MCDs are doing their job? I think we've lost our connection with Dr. Sanjeev Bagai. Dr. Santosh Mehrotra? As a citizen, when you look around your city, do you believe that the city is clean? That the MCDs are doing their job?
Of course not, Faye. I mean, it is appalling. It is disgusting that we call this the capital of our city. I mean, it may be very nice to say that we put waste bins in one ward of one part of our city. Can you please hear me out? I didn't disturb you one bit when you were speaking. It is humanly possible in our country to produce waste bins which are not possible to be stolen. Did we think about that? Have we thought about that? Has your party, has your government thought about that? You cannot keep throwing the ball in other parties' court. You know, so let's at least begin to think, when we are facing a crisis, that we should be at least providing such waste bins which don't get stolen. It doesn't require a great deal of imagination to come up with waste bins which don't get stolen. Isn't it obvious that in our poor country that waste bins are likely to get stolen? Why should waste bins have been provided which you knew were going to be stolen? Isn't that self-evident to me? It's self-evident to me. Isn't it self-evident to those people who put them up? I mean, for God's sake, that's not a defense that, oh, the citizens have to cooperate. First, you have to use your imagination so that you think about what might happen.
You know, I want to bring in Advaita Kala, who's on the phone line with us, an author and a scriptwriter who lives in Delhi. Advaita, if you've been on the line this entire time, you've heard, and we don't even have the Aam Aadmi Party. I want to remind our audience one more time that the Aam Aadmi Party representatives don't even come to these debates. They don't make themselves accountable at all. They refuse to answer questions, tough, easy, whatever it may be. They refuse to. And I want to point this out again and again. When we called them about Delhi flooding, they did not give us a response. When we called them about this health issue, they did not give us a response. They did have the time to constantly respond to the media about a sex scandal. And I think that should list out the priorities of that government. The fact that a sex scandal took precedence over the citizens of Delhi, 20,000 citizens of Delhi who've been diagnosed.
They're ready to compare it with Mahatma Gandhi and Nehru.
With vector-borne diseases, there aren't enough doctors, there's no medicine, there's no nurses, and the entire capital right now is preoccupied with a sex scandal. I think we should be ashamed of ourselves. Advaita Kala, tell me what you feel as a citizen of Delhi.
I couldn't agree more. You know, the AAP has been missing in action really when they were needed the most. I mean, I'll give the BJP this much, you know. At least they're coming up. I've done multiple debates on this. At least they come in, they listen. Sometimes their attitude goes off. But otherwise, at least they're listening to feedback from citizens who are frankly just frustrated of this. You know, I have to tell you, last year, Arvind Kejriwal was on Twitter and was tweeting about 200 mm of rains and how his government, because of their intervention, the waterlogging had been much less that year, and it was going to be even better the following year, which happens to be this year, and it's a complete disaster. So the point is that to take credit, they're very available. You know, they're right there in the forefront. When it comes to carrying the can, we don't see them anywhere. I mean, there's absolutely no sign of them. When it comes to the PWD, I'm even going to appreciate the Delhi police right now because they identified 163 drainages and communicated it to the PWD that needed to be desilted, that needed to be put in place 2 months ago. Nothing came of it. Nothing happened. I mean, this is gross incompetence. You have doctors falling sick. You have 30 doctors falling sick in the capital because of dengue. Who's tending to the patients? Safdarjung Hospital, media reports say, is overflowing with patients and understaffed with doctors. It's a complete crisis. There isn't one response either from Satinder Jain or from Arvind Kejriwal or from anybody. And this is supposed to be the people of the party. Where are they? That's my only
Where are they? Where is the government of Delhi? I've run out of time, but I do want a response from Dr. Bagai. Dr. Bagai, you're the one who's actually dealing with this issue. You've diagnosed and helped 6 patients with dengue. Today you say Safdarjung Hospital, 30% shortage, 25 junior doctors are sick. Ramon Loria Hospital, the RML Hospital, 30 doctors are sick. AIMS, 50 medical staff, 12 senior faculty members sick. Gangaram Hospital, 10 doctors are sick. Ambedkar Hospital, 10% of the doctors are sick. Tell us what you need. We don't have the state government. The state government refuses to be part of this conversation. But we have representatives of the MCD and the BJP here. We can communicate with them. Tell us what you need.
What I would like to Yeah, what I would like to see is a proper road maintenance system in Delhi. I would like to see desilting of the drains done on a weekly, monthly basis, 12 months a year, not only pre-monsoon or post-monsoon. And very, very important is we are harping on mosquitoes and fogging. Please understand, medically, fogging has very poor penetration and does not control dengue or malaria. If it did, we won't be fogging again and again every year. We need an anti-larva measure. We need to go to the genesis of the problem. Internationally, countries have achieved this. I think we need a more systematic approach. All the agencies, please, with folded hands, I'm begging, let's all of us work together. We are seeing the end point of it. We see the flack of it. And let me tell you, there is nothing worse in medicine than to see a young child or a young adult lose his or her life from a vector-borne preventable disease. For me, that's the biggest shame in medicine which I can ever face.
Vector-borne diseases are completely preventable, yet somehow we wind up in this place year after year, unable to prevent them. I want a commitment from Shobha Vijendra of the MCD that a conversation that I will facilitate between you and Dr. Sanjeev Bagai on how we can handle what's going to come in the next couple of months when the citizens of Delhi are going to only fall sicker. We're only going to get more and more cases of dengue and malaria and chikungunya. If we can facilitate a conversation between you and the doctors, so little children like the one on our screen right now don't have to be sick and don't have to wait in long lines outside fever clinics for help in any way. I want to thank our panelists for being part of this conversation. I want a commitment from the various agencies who run the city of Delhi that we will in fact work together. The conversation on Magic Bricks now focuses on urban issues and issues that impact our quality of life as taxpayers of urban India. Stay with us. The conversation continues.
You can watch live TV on our website mpnow.in. Find us on Facebook at facebook.com/magicbricksnow. And don't forget to click the like button. You can also follow us on Twitter at magicbricksnow. To stay updated with all our programming, hit the subscribe button on our YouTube channel by logging on to youtube.com/magicbricksnow.